Now to the latest on COVID-19. Federal health officials are now recommending everyone 12 and up, originally vaccinated with Pfizer, to get the booster shot after 5 months instead of 6 months. The CDC is expected to sign off on booster shots for 12 to 15-year-olds as early as this week. More than 100,000 infected Americans are now hospitalized. That's more than double the total from early November. And today, President Joe Biden doubled the government's purchase of Pfizer's COVID-19 pill.
These pills are going to dramatically decrease hospitalizations and deaths from COVID-19. They're a game changer.
According to the American Academy of Pediatrics, 325,000 children tested positive for the virus last week.
And the state of Michigan broke another record, reporting that 96 children are in the hospital with coronavirus. That is a pandemic high. Dr. Rosemary Olivero of Spectrum Health says we are seeing tons of new cases in pediatric patients and a very high positivity rate right now. She added that doctors are also seeing an increase in the number of Miss-C cases in children. That's the very serious inflammatory syndrome that can hit 2 to 6 weeks after having COVID-19.
For most of the fall, we saw no cases per week, maybe one case at most. But over the past 3 to 4 weeks, we've seen at least 3 to 4 cases per week. And of course, this is important because a lot of the children who develop multi-system inflammatory syndrome do get very ill and need to come to our intensive care unit for care. So we are seeing that the COVID landscape for children is extremely active right now. And so really the main point of vaccinating to prevent severe illness and keeping up with our mitigation strategies.
She says, quite simply, children who are of vaccination age should get vaccinated, and masks are very important in stopping the spread. We also asked if there was any chance health departments might reinstate a mask mandate for children, and if Spectrum was involved in informing that decision. She says they will work well together, but it is complicated and it's unlikely a mask mandate will be reinstated.
Children returned to school yesterday after the holiday break. It's also when countywide mask mandates in Kent County and Ottawa counties expired, although some districts decided to keep it in place. But with these rising cases of COVID-19 in children, do you know what symptoms to look for? And when should you keep your students home from school? If your child has a new onset of fever, runny nose, cough, congestion, muscle aches, or loss of taste and smell, you should take them to the doctor for a PCR test to know for sure.
If they have a little bit of a runny nose and a PCR-based COVID test came back negative, then I think we can say that it was negative and this isn't COVID. So if they're feeling well enough, then those kids can go back to school. I would recommend that they wear a mask so they don't spread the cold around the school as well.
Doctors say most kids with COVID-19 experience mild symptoms, but there are rare cases that can become severe. If your child is having trouble breathing or shortness of breath, they should be seen by a doctor immediately.